This new report from the left-leaning Politico, they say it'll take 3 years to repeal and replace Obamacare. Let's bring in Betsy McCoy, author of Beating Obamacare. Now, 3 years to repeal and replace. What do you make of that?
It doesn't surprise me at all. After all, it took 4 years from the time this law was enacted until it was put into effect. 4 years. So 3 years is actually a pretty reasonable estimate. But Congress doesn't have 3 years because it's very likely that insurers will start, who haven't pulled out of the market yet, will pull out quickly. In other words, in a third of the counties in the United States, all the insurers have quit Obamacare except one. People in those counties only have one choice of insurer because the insurers are losing billions of dollars trying to sell these plans to healthy people and chronically ill people at the same price. So, the healthy won't buy.
So the insurers who are left in the Obamacare market, you'll say they're going to be forced out relatively quickly because they're losing their shirts.
They're going to hurry to the exits. Their stockholders are going to say, whoa, we thought the Democrats were going to get elected and make some sort of compromise and put more money into this. Instead, we've got the Republicans repealing it, so why stay in and lose money for another 2 or 3 years? There is a solution, however, and that is the Congress should enact block grants to the states to create high-risk pools in every state for the very costly patients who are enrolled in these plans. That will bring down the premiums and deductibles for everybody else and normalize the market for 3 years.
That is part of Tom Price's plan. He's Health and Human Services.
But they could do it right away because they're spending $43 billion on subsidies for these plans. The block grants for the high-risk pools would cost about half of that.
You could just do that.
You could just do that.
I mean, literally just like that.
That's right. You could do that, and that would prevent the insurers. Yes, but it would be the kind of legislation that can be passed with a mere 51 votes. That's important, too.
But you really think it's not 3 years' worth of work in Congress. It's much shorter than that.
That's right. But then the states have to get ready. They're going to be the ones regulating a lot of the insurance market after this is repealed. And regulations have to be written and put into place. And the insurers have to get their new products ready. And that's why Politico is saying 3 years. Maybe it can be done in 2 years. But Congress must act to avert this one crisis, the insurers heading for the exit.
Where does that leave all of those people who are now facing a 30, 40, 50% increase in premiums?
Don't say all of those people, because really, of the 20 million who newly gained insurance, 16 million are on Medicaid. They're in the public program for low-income residents.
What about the rest of them, the other 4 million?
That's right. They have to be taken care of. That's right. And that's why I'm suggesting if you block grant to the states enough money to create these high-risk pools, you will see the premiums and deductibles go down. Alaska did it on their own last June. They were facing a 40% premium hike in the Alaska individual market. They said, we're going to set up our own high-risk pool and pay for it ourselves. And they did, and premiums only went up 7%. Normalizing the market.
So it's over, and it's going to be over real soon. All right.
Goodbye, Obamacare.
You've been carrying that thing around for